Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER physician and Director of the Hawaii IPA. I'm so pleased to have this opportunity to speak with you about the key health issues in the state of Hawaii. We've been coming to you about twice a month for this last many months, and we've had extraordinary discussions ranging from the state of JABSOM, our medical school, Director of Health, HMSA's executives have been here. We've talked to people about health disparities and the physician shortage. We've really been touching on so many issues that it's hard to sometimes find emerging great topics to talk about. But we got lucky this week. Today I have Dr. Melissa Viray here. Melissa is the Deputy State Epidemiologist here in the state of Hawaii. She is a disease surveillance and investigation expert. She basically knows about infectious disease. Now, a lot of you have heard about different infectious diseases, but we're going to have her unpack what that means to us here in the state of Hawaii. She studied internal medicine. She's a physician. She did that at Mount Sinai in New York. She went to MIT, a lousy undergraduate institution, as you know, and the CDC, where she worked, and then also had an infectious disease degree at Washington University. So she comes to us very well recommended, very well trained, and really expert in her field. So Melissa, welcome.
Thank you for having me, Josh. I really appreciate it.
I'm so pleased you could come. Like I said, we've talked on this show many times about different aspects of our healthcare system. We often talk about health insurance. We talk about whether or not you can find a doctor. We talk about all of these different challenges, but we haven't spoken as often about the technical challenges of actual disease. And that's why I wanted you on the show today. So could you start, tell us a little bit about yourself, what brought you to Hawaii, and what your interests are as far as infectious disease goes?
So I come to Hawaii, again, with an infectious disease background, did my training at WashU, and before then was at Mount Sinai doing internal medicine, and I did some time at CDC doing epidemiology work, which is really the science of transmission of just transmission of diseases. And so what the heart of my interest is, how does disease get from one person to another person? And when, in the case of infectious diseases, how can I break that cycle? How can we change things so that more people don't get infected? And what brings me to Hawaii is there was a great opportunity to join the state of Hawaii in terms of in the field and at the level of the state, working on a day-to-day basis to interrupt that chain of disease.
So let me understand this a little bit better. So you're a physician, right? But you study this broad area of infectious disease, and that is, just for our viewers who might not know, that's like bacterial infections, viral infections, and these things break out, and then we have the providers, they either have to treat them, but you're actually focused on stopping them or figuring out where they came from. Is that right?
Right. So it's just a cog in the wheel, so to speak. It's very important from the clinical aspect for the providers who see and diagnose and then treat these patients, because obviously you need to treat the patients.
Right.
But from my end, taking a step back, I see what all of the providers have diagnosed or what all the labs have found, and I say, well, goodness, there seems to be a lot of this particular viral disease, bacterial disease, or there seems to be more than this than we expect, or we don't expect, and wow, that's unusual. We should investigate if there's a point source, or if there's exposure there that we can interrupt and prevent more disease from occurring.
So you're really looking at healthcare and specifically infectious disease from kind of like the 30-foot elevation, is that right?
Right.
You have access to kind of a global perspective. So a doc like me who's sitting in the emergency department, I might diagnose one person with that tough infection, that MRSA infection.
Right.
But you're able at the Department of Health to say, you know, Josh, there were 15 cases that occurred on the Big Island in the last week. We need to look into that. Is that a good example?
That's a even better example would be, say, something like measles, which is something that we rarely used to see, and in fact in 2000 it was declared eradicated in the U.S. Thank goodness for vaccinations.
Yes.
But now that we've got dropping vaccination rates, we're seeing more and more measles crop up. And so now, for example, you would see one case of measles, and that's already alarming as it is. And then we would have to say, what did that person, who was that child exposed to? Who else might be susceptible to disease? Who else do we need to make sure that we contact, prophylax, investigate, to make sure that we don't have more disease from that one child?
Interesting. So that's a very active role the Department of Health plays. Does that mean you notice, or it's reported to the department, that there is an outbreak of infection, and then you actually call the direct physicians and the families in the schools? Is that how that works?
So there's a fairly long roster of reportable diseases in Hawaii by state statutes.
Yes.
And what happens is, in the case of measles, Exactly, that's exactly what happens. They report to us, or we hear that the test has been performed. We reach out to that physician, we'll reach out to that patient, their patient's families, we'll reach out to whatever doctor's offices that family may have been to. We make a lot of phone calls, a lot of visits to make sure that we contain infection as soon as, or contain exposures as best we can.
Why don't we, let's dive into some of this. Now, you said that there are some diseases that are reportable. What does that mean to people? When you say a disease is reportable, does that mean the physician should be reporting it? Does that mean when a parent has a child or they themselves have an infection, it should be reported? How does that work?
Right, that's a good question. And it means a number of different things. For example, of course, if a parent is concerned or any of the public is concerned, we definitely, and they want to report something to the Department of Health, we want them to call us if they're worried.
Yes.
And you have a question and you feel like it needs to be addressed by the Department of Health, certainly call us.
Right.
But in general, the way reporting works is the most efficient tends to be from the laboratory.
Got it.
Because people tend to get lab diagnostics, and
Right.
we've set up systems so that when these labs occur, it comes to us directly. It's very fast. Physicians are human.
Yes.
I'm a physician, I understand this. We can be a little delayed in our reporting. Sometimes we're not as good as we could be about reporting, but we still very much, and our physicians actually here in Hawaii are very, very good at letting us know when something is going on. In fact, I'm very impressed at how good our physicians are here at reporting. We have a very good relationship with them, and they come to us and they say, oh, there's something going on here. There's something unusual here.
Interesting. So let me backtrack a half step. So the labs, okay? So someone comes in, their physician or their nurse practitioner or whomever has ordered a lab. Is it automatically reportable? Is it that list of infections that automatically get reported to DOH if it comes up positive? Is that how it works?
It depends on the list. In a lot of cases, that's the case.
Okay.
In some cases, it's a condition where we may not automatically get it, but in cases where we're of higher interest, we might request that they submit them.
Okay.
But in many of the cases, yes, it's automatic. We just pull them.
So what kind of, give me some examples. What are some diseases that we report in the state?
Oh, goodness. They're measles, mumps, rubella, salmonella, E. coli, shigella. I could keep going.
So there's a ton of them, right? So you first mentioned those ones that are kind of classic, measles, mumps, things that, because we've had immunizations, they're supposed to be gone.
Supposed to be.
But you said they were starting to see a few cases because some people have chosen not to get vaccinated. Now, I'm a very strong proponent, like you, I know, of everyone getting vaccinations, and this is not meant to be a public service announcement for vaccinations, but I will say, as a doc, I do like to know that our children and loved ones and families can't get sick, okay? But setting aside that philosophical question about immunizations, so there's those diseases. Now, can those diseases kill you? I mean,
absolutely.
Okay.
And one of not to go with a public service announcement,
Yes.
but one of the reasons it's so important to get vaccinated is because I think in a lot of cases where we don't see these diseases anymore, like polio, like measles, we forget these diseases were horrible.
Right.
They were paralyzing. They caused incredible morbidity and mortality.
Right.
And now we don't see them, so we're not as afraid.
Right.
And I very much do not want to see them again.
Yeah. I'll tell you, I have an uncle who had polio back now 60 years ago, and he still had some hemiparesis or weakness for those who aren't physicians watching the show. And it is terrible. And of course, many people died. And other diseases that you're describing, that if we have outbreaks of them, they can not just cause these rashes and high fevers that we see in kids, but they can cause meningitis. They can cause encephalitis, which is brain damage essentially for those who don't know, and it can cause deafness, if people have the wrong infection. So what you're saying is you're trying to kind of head these things off at the pass.
Exactly.
Is that
That's
right?
exactly right. If we can prevent through immunization this disease to begin with, we don't have to worry about all these complications, all these long-term complications, all these people who didn't need to have brain damage, didn't need to be blind, didn't need to be paralyzed. And it's a very simple and a very safe mechanism for preventing disease.
Now, give me an idea before we head to our first break. Kind of, what is the size and scope of the operation? We're a state of about 1.4 million people. How many professionals like yourself are looking at the epidemiology of these diseases in your department?
So in terms, we have a fairly large, well, in my humble opinion, a fairly large division.
Yes.
And of course, the Department of Health covers more than just infectious disease. We cover environmental health and maternal child health and such things.
Right.
But in terms of division of infectious diseases or communicable diseases, I would say a good 60, 70 folks just for infectious disease.
Interesting. So there's a team of 60 or 70, of which you're the deputy director?
Deputy, yeah.
Okay, right. So, and you're looking at all the data as it comes in, like you said, from labs, in some cases from physicians' offices directly, maybe even from a school or from a parent or whomever.
Absolutely, yes.
And then you investigate it and you decide whether action has to be taken.
That's exactly right. That's exactly how that happened. We get a report, and we may, depending on the type of report and depending on what comes in, we will decide whether or not that we need to contact parents, contact schools. Do we need to close down a restaurant? Do we need to educate on appropriate sorts of hygiene interventions that need to happen in the hospital, in the long-term care facility, in the school, or in the household even, in terms of stopping the propagation of infection. And all based on what reporting we get from labs, from physicians, from school teachers, from individuals even.
Do you end up going into the field, or is it mostly data-driven, so you get the data and then you communicate with people by the telephone? How often do people from your team have to actually go to a community or go to a school? And what's that like?
All the time. So it depends a little bit on the disease. My position, sadly, doesn't get to go out in the field as much. But our investigators frequently will go out to schools, will go out to hospitals, will actually go out to individuals' homes to collect samples.
Interesting.
In pursuit of whatever diagnosis we need to get.
So you're going there to verify what the heck is going on the ground.
And also to get better information. And a lot of this is based on, you ask the individuals, what were your exposures? What was your disease like? What did you have before your disease? And you look for commonalities in between individuals, which might point you to a single point exposure.
Interesting, interesting. I mean, it's just a really fascinating thing that you do. And how many cases do you get a year for the department?
Of which?
Boy, good.
That's a very good question, depending.
How many different, what's the universe of investigations that you guys have to do per year?
Oh gosh, I just saw that number roll by my desk and now I couldn't even tell you. I just saw that number too.
Is it daily you have several different cases, or is it come in clusters? How does it usually go?
Kind of when it rains, it pours.
Yeah.
No, it's one of those things where on a regular basis we're getting reports of illness.
Right.
And so sometimes we just notice that there's more than we're used to. During the flu season, for example, we'll get cluster reports. So nursing homes or schools will say, we've got 20% of the school kids out are missing that day, or 20% of my classroom is missing. Or we might get, restaurants or folks calling because my friend, my sister's friend, and 18 other people had this illness.
Interesting.
So it depends a little bit on the illness.
Okay.
But certainly, it's not boring.
Okay. Well, I think that's a very good place for us to take our first break, and then we'll begin to talk more specifically about some of the outbreaks and really what some of the concerns people out in the community might have. Okay.
Sure, absolutely.
Great.
Thanks very much.
My name is Josh Green. I'm your host on Healthcare in Hawaii. Today I'm joined by Dr. Melissa Viray, who is an epidemiologist at the Department of Health, and we're talking about infectious disease in Hawaii. Thanks for joining us.
Aloha, my name is Willow Chang Elion, and I host a show called The Art of Life. We air live every Friday from 2 to 3 p.m. And what we do is basically we focus on individuals who create a unique sense of place for Hawaii. These are movers and shakers, artists, innovators. They are also traditionalists. They're all involved in the archival process, and they make this place a unique place, one that makes Hawaii a richer place to be. I hope you do join us, and certainly tell your friends about the show, whether they live here or they live abroad. It's a way to give back to our community. We're keeping it.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, Chairman of the Health Committee at the Senate. It's good to be with you today. Today I'm speaking with a guest, another physician, Dr. Melissa Viray, who comes to us from the mainland originally, where she studied at Mount Sinai, University of Washington, worked at the CDC, has a very broad experience in infectious disease. And it's important today because we're seeing different stories break out across the country of infectious disease and across the world. We've all seen movies like Outbreak, and they're very dramatized. There's now television shows that must really be making people interested in your field.
Yeah.
The movie Contagion came out. We now see this show, what was it, The Last Ship, where there's an infectious disease that's killing people. And I think a lot of times in Hollywood, I won't say it glamorizes these illnesses because they're quite tragic, but we have you today to talk about what the real world experience is. So we were briefly, before we went to break, talking about kind of what you do in general in the department. and dealing with kind of the day-to-day of infectious disease. Why don't we talk now about some of what the worst outbreaks you've seen have been, and what that kind of looks like. What is that? Is it life-threatening, or is it just a lot of people? What's it like?
So it depends a little bit on, scope of disease. When I was at the CDC, for example, we would have outbreaks that were nationwide, multi-state, things like Salmonella St. Paul, where it was either in the tomatoes or the cilantro, depending on who you talk to, and may not cause a lot of deaths, but can be complicated in the right population and can cause a lot of morbidity, certainly, and was nationwide. We had a lot of people affected by that. Or you could have something as small as, for example, I went abroad to Uganda for an outbreak of botulism, which is, for those who don't know, is a disease where it's a toxin-based disease that you take in by eating bad food, and then you can be paralyzed from head to toe and not be able to breathe. And while there were only 3 cases, one of them died. And so even small things like that can be incredibly tragic.
Right.
And now one of the ones that I know is getting a lot of media press right now is the very large Ebola outbreak in West Africa.
Right.
And it is an incredibly unfortunate situation in Africa, and it is something that at the Department of Health we're obviously keeping a very close eye on, just to make sure that we know what's going on, and keeping in touch with CDC to make sure that we know what the guidelines are, what the situation is, and making sure that we're keeping abreast of the situation. But I will say that the risk of something actually coming to Hawaii, or even to the mainland in general, and for a case of Ebola to walk off a plane and come to our state, it's incredibly small, so small. And even were that to occur somewhere on the mainland, I mean, you've done work in Africa. It's a completely different animal.
It is.
The infrastructure there is so different. The hospitals there may not have, sometimes in those areas, sometimes they don't have running water. Sometimes there aren't floors. You have multiple people in the same, in a very large room getting care together.
Right.
It's really hard to do the kind of infection prevention that we really take for granted here in the States.
Right. Yeah. Even when I did, I'm so glad you brought up Ebola, because it's the kind of the elephant in the room for a lot of people, right? When I worked in Africa, and it was inside of South Africa in Swaziland, we did our best to make sure all of our our tools were cleaned, for instance, but sometimes the autoclave would break down, but there were still car accidents, there were still tragedies.
Exactly.
And I remember many times thinking the standard of infectious disease control, or standard of cleanliness or safety, though we did absolutely our best and we did everything possible to prevent disease spread, it didn't get anywhere close to Penn State or Dartmouth or wherever we were training, right? So it really was possible to see large outbreaks. In fact, in the hospital I worked in, 58% of the individuals were HIV positive.
Right.
So that's the classic large infectious disease we've been talking about for many decades now in America and worldwide. But you mentioned Ebola virus, right? So why don't we, because as a senator, people say, okay, what's our risk? What's the risk assessment for us as a state where 6-7 million people want to come visit Hawaii? We come and go, we fly to the mainland, we fly to Europe, we fly all over. Tell us a little bit about that virus. Tell us, you said it's very unlikely that it walks off a plane and comes to us, but what do we have to worry about here as a tourist-based island state?
Sure. So first question, what is Ebola? Now, Ebola is a virus which it really arose in Africa, and it's really only been seen in Africa. And it's a disease that is transmitted through contact of bodily fluids, spit, saliva, blood, feces, with an exposed mucous membrane or open skin, in your eyes, swallowed. So it's not something that if I cough at you and you're in the same room that you're going to be infected. It's one of those things where if it happens to be you have an open cut and something gets on the open cut, that is a risk.
Okay.
However, that being said, taking a step back, the real risk of somebody coming to, again, like I was saying, somebody coming here with Ebola is just very small. It's actually becoming, for better or for worse, it's becoming very hard to leave those countries right now. The airlines are shutting down services.
Right.
There's exit screening. They're trying to close the borders as best they can in those countries. And we have, we at the DOH work with the Customs and Border Patrol. We work with CDC's global DGMQ, which is global migration and quarantine division here in Honolulu to kind of make sure that we're tied into whoever might come in through the airport. Ebola, not going to be Ebola, but like Ebola, flu, whatever.
Right.
If there's something that's worrisome, they let us know.
So, okay, so you guys are in many ways the gatekeeper on infectious disease questions, right? So if someone is on a plane and they become very, very sick, have a high fever, start throwing up a lot, they'll be able to contact you at Department of Health, and you can then do an assessment when they come in. Now, on so people understand, we have a couple different ways diseases are transmitted, which you described. One of them is like bloodborne or fluid-borne diseases. So it's very difficult to contract that unless
something
happens, and it's a terrible exposure, right? And then there's other infectious disease that's like airborne, right? So tell us a little bit about that.
Things that I worry about where it's things like tuberculosis are your classic airborne diseases where somebody with tuberculosis has that bacteria, it's bacteria, and it hangs out and it infects your lungs and it grows in your lungs. And someone with tuberculosis, when they cough, the bacteria can actually hang out in the air. And if you're exposed for a prolonged period of time, it can actually lodge, kind of take up residence, and you become infected.
Got it.
That's a worry for TB. Influenza and measles, for example, or for a different set are viral diseases that it's in the droplets that you cough up. And those little droplets, they can be small. Some of them can be small enough to hang up in the air, but a lot of times it's because you get coughed upon.
Yep.
Those
or
little
someone
droplets
sneezes on you, coughs on you, and then you get those viruses.
and you get those viruses, and maybe you rub your eyes, or maybe it hits your mucous membranes, and then you get infected. Those are very different from something like HIV or hepatitis C, where you have to have virus in the blood, and a pretty significant blood contact exposure to your inside the skin, so to speak.
Yes.
So a break in your skin, that's a pretty significant break.
So I guess for people who are lay people, it's very difficult, relatively speaking, to contract a serious virus like Ebola or quite a serious illness like HIV. Whereas because they're bloodborne and you have to have a very significant exposure, as opposed to the flu, where people have influenza, they don't even know they're sick quite yet, they're coughing a little bit now, they're in a big group, they're at school, they're at work, and then a whole outbreak occurs because they spent a few hours sneezing, coughing, and not washing their hands enough perhaps, and I give it to you and you give it to a few people.
The key one on that one is measles. For example, what they talk about is that concept, and they talked about it in Contagion, the R0.
Yes.
The average number of secondary cases that you'll see for a single case.
Yes.
And the number for measles is 12 to 18.
Oh, wow.
So that over the course of their infectious period, somebody with measles can infect 12 to 18 susceptible individuals. That's an incredible number of sick people.
Interesting.
And if you have a susceptible population, what that might mean is you start with 1, then you've got 12, then you've got how many, and it just explodes, which is why it's so important that diseases like that be contained as quickly as possible.
So you see a case like that, something with one of those R0 scores of 12 or 18, and you jump on it because it can slaughter us.
The good news for something like measles is that, at least in Hawaii, we've been fairly lucky with good vaccination rates.
Good.
Hanging out in the 90+%. In prior years, we haven't seen this year's data yet.
Yes.
I'm hoping it's still going to be good in terms of our youths and our teenagers. But if that falls behind, below a certain level, we risk being we eradicated this disease, and we risk losing that status basically.
I get you. So if we fall below a certain threshold on immunization rates, we could start seeing outbreaks, which in turn, more and more. And I do, I represent a community on Big Island where I have pockets of constituents who, God bless them, they have strong feelings on this issue, and some people don't like immunizations. I worry as a doc in the community that I respect everyone's wishes to choose their own medical course and what they want to do, but they have to realize that they not only expose themselves to getting infected, but others as well, who might be more frail, who didn't get adequate immunizations, and so on.
I feel like one of the big objections I hear from individuals who don't want vaccination is oh well, it's only me, it's only my kids, who am I hurting? But the problem is there are a number of people we can't vaccinate. There are people who are immunosuppressed, have certain infections or certain comorbidities, and we can't give them vaccine.
I get you.
And so who those unvaccinated folks are putting at risk, all of those folks.
Are these people like that have had organ transplants?
Exactly
Okay,
who
yeah.
I'm thinking about. It's
Okay,
exactly
so
who
yeah,
I'm
so
thinking
that's a
about.
big we've had people on the show, we've talked with the Kidney Foundation before about larger and larger numbers of people with kidney failure and getting kidney transplants. So they go on these medications and
can't have these types of vaccines. There are certain vaccines they just can't get. And they are at incredible risk for terrible, terrible outcomes from a lot of these diseases.
Yeah.
And so and that's part of, when I'm getting on my soapbox about this, that it's so important that people maintain, immunization, adequate immunization, especially if they're going to be going to school, if you're going to be out in public, but if you're going to be traveling abroad, oh my goodness, it's so important.
or if you're a teacher or if you're in healthcare, of course.
Any sort, right. It's
Okay.
very important.
So that's very good to know. So okay, we've talked a little bit about Ebola, and it's doesn't appear to be a threat to us
would not
here.
worry about
It is, of course, it gets a lot of attention because it has a very high mortality rate, right? Which means that based on the percentage of people that get the virus, large number die. Could you tell me about that?
Yeah, I'm not worried about it coming here,
Yes.
but there's no getting around the fact that it is a very serious disease. The numbers that they're seeing are in the 50-60% rate mortality, which means that for every 10 people who get sick, 5 or 6 of them will die.
Wow.
Now, that being said, again, I don't know if this happened in a developed country with advanced medical treatment, whether or not that number would be the same. It would still be higher than we would like.
Right.
But the problem is that this is a very severe disease, and a lot of the caution that's coming out of, that we're taking, and a lot of caution that's coming out of CDC is because this disease is so severe, if it does happen, we want to be prepared. And that's part of the reason that we're keeping an eye on it, and the hospitals are keeping an eye on it, and CDC is keeping an eye on it and getting actively involved.
Right.
Is not because we're super worried that it's going to come here. It's because we don't want it to come here. And if it does, if it goes anywhere, it's going to be a bad disease.
Right.
But we're prepared.
That sounds so, it's actually quite reassuring, actually. So it's reassuring to know that you have the infrastructure to assess and deploy resources in case
Something
we're
does
worried about that. But I'm guessing that there are many other illnesses that even are kind of
Right.
more kind of on the forefront of what your work is. Why don't you tell us about a few that you work on much more routinely?
Right. So actually, that's a very good point, is that everybody's worried about Ebola, but I'm worried about measles and chikungunya, because in terms of things that are going to come into our airports, it's not going to be Ebola, but it very well could be measles, which we've talked about, or chikungunya, which is...
What is that? Yes.
Chikungunya is another viral disease, and that's transmitted by mosquitoes.
Okay.
And it used to just be in Asia, kind of the Indian kind of peninsula area, kind of Oceania. But now we've also seen that in the Caribbean, we're starting to see local transmission explode in that area, and that's brand new in the last couple of years. And so we're seeing an increasing risk of this disease, which causes... it's very similar to dengue, which causes very bad muscle aches, bone pain, very high fevers. And the worrisome thing about chikungunya is that these joint swellings and joint pains can persist for months to years after the disease is done. And so we really don't want our folks to have to worry about that.
Have we seen cases yet?
Now,
here?
we've had a handful of imported cases here.
Yes.
And luckily, they've been isolated cases. And the one thing we worry about at the Department of Health is the kinds of mosquito vectors that we worry about for chikungunya are present here in Hawaii. So we always try our best to get on top of it and get our vector people involved, make sure we follow very closely, because the last thing we want is to have local transmission of this particular disease.
And we don't want it to become endemic here in the state of Hawaii.
Exactly,
Okay.
exactly.
I think this is another good place to take a break, and then when we come back from our second break, we'll talk about kind of the infectious diseases that keep you up at night, and talk about what we really could face if we had a big outbreak. Sound good? Okay. So I'm Josh Green, Healthcare in Hawaii. Thanks for joining this week as we talk about infectious disease in Hawaii.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha, welcome back to Healthcare in Hawaii. We're chatting in the break and almost missed the start, mainly because it's such an interesting topic. I'm Josh Green, I'm your host at Healthcare in Hawaii, and I'm joined by Melissa Viray, who's a doctor who's focused on infectious disease for her whole career. She trained basically at the preeminent universities and then worked at the CDC on the mainland. So she brings a wealth of information to us and expertise to us in this area that really, from my perspective, is one of the potential threats to us in Hawaii. Infectious disease, which is virus or bacteria, sometimes bloodborne, which means you can only transmit it if you exchange blood or fluids. Sometimes it's airborne, where you cough on somebody or sneeze. It has a very wide range. As Dr. Viray was telling us earlier, you have some very serious illnesses like Ebola virus, which is right now contained in Africa, which can kill you, kills 5 or 6 out of 10 people, but it's very unlikely to come to the state of Hawaii, as opposed to things like influenza. We get the flu every year. So there are other illnesses that are much more prevalent, and that's what I want her to focus on now. So Doc, tell us a little bit more about, I mean, it's cliche, but when you worry about infectious disease, what keeps you up at night when you think about what could really slug Hawaii in the gut? What would be a bad scenario, or what's possible when we talk about infectious disease in our state?
Things that keep me up. There are a lot of things that keep me up at night, and some of them some of them are just me being paranoid.
And that's kind of your job. It's
that's
interesting,
kind of-
right?
that's
Your
kind of my
job is to
job.
worry about what could happen, isn't it?
What could go down and what could be wrong. Things that we worry about and things that we watch for
Right.
in terms of, I do want to go back to the influenza thing, but before I go into regular influenza, something that we've kept an eye on for a long time that we've been very lucky with is the avian influenza issue.
Tell us about that.
Because avian flu, there's H5N1, H7 and 9, different variants, different severity of disease, novel influenzas, generally coming out of Asia. And we see a lot of tourists, a lot of travelers coming here for family, for visiting,
Right.
and people who go back
Right.
as well. And so something that we always keep an eye out for is whether or not, we're going to be that canary in the coal mine with that, avian influenza case. Now, as it turns out, the first H5N1 was over on the other side in Canada. So we're not too worried, we haven't gotten unlucky yet.
So this is bird flu, right?
This is exactly
okay.
right.
And so you're talking about a scenario where it's mostly in Asia, although it can be elsewhere. Someone flies in and they basically have this bad strain of flu. And how would you know whether, just for people who don't do this for a living, how would you know that it's bird flu versus regular flu?
So some of the things that we look for is that we have actually a lot of influenza surveillance going on all the time, actually year round, in terms of making sure that physicians actually report how many influenza-like illnesses they see. We actually get samples that we test, and some of which go off to CDC for very detailed characterization. But even the ones that don't go off to CDC go through a fairly rigorous set, a number of them go through a rigorous set of testing here at our state laboratories division at Department of Health.
Right.
And if they don't, and we look for certain ones that we expect to see in seasonal flu. This pandemic H1N1 has been around for a while now. We see it all the time. H3N2, we see it, it's okay. If something comes up and it doesn't behave like it's supposed to, it's a little more severe, or it doesn't, when we try to characterize it, doesn't characterize properly, those are big red flags for us that something might be going on. Now, and that, triggers a whole,
Right.
slew of things.
So someone, you're in the office at the headquarters of DOH, you start receiving some reports that there's a flu that's behaving differently. It's a little, it's not the exact same patterns of fever, or it's not responding as well, or maybe more people are getting severely ill. That's what triggers, am I correct? That you to go into the field and figure out?
It depends. Yeah, it depends a little bit on how that presents to us, and a little bit it depends a little bit on the numbers that we're seeing.
Right.
And because the first question you have to ask is what's actually going on.
Right.
Is it a reporting issue? Is it verify what you've been told, verify what we've been seeing, get more data, collect more information about what's the actual pattern of disease? What sort of lab results are we getting?
Got it.
And then you do a little bit more of a deeper dive. If something's still abnormal, you go a little deeper, go a little deeper.
You mean you like get more laboratory tests and send it off to better or fancier labs?
Or
How
maybe
does that work?
even just as much as making sure that lab tests has been, the appropriate lab tests have been done. If they were only able to do typing for flu, we can make sure they do subtyping as well. Maybe we'll look for resistance. Maybe we'll look for this, that, and the other.
Okay.
And it's one of those things where there are a number of steps that we can take
Right.
if we detect an abnormal signal. For example, if there's a spike in illnesses during the low season,
Right.
because we always have flu all year round.
Right.
But we don't expect to see a spike in the middle of the summer.
Okay.
And if we were to see something unusual, that might trigger a bit of a deeper look.
Okay. And how often does that happen? I mean, when was the first, I can't recall actually, when was the first bird flu outbreak? Was it a few years ago?
Several years ago, age 7 and 9, and that would have been a good couple of years ago. I can't give you the number off the top of my head though.
Okay, so you saw those spikes and then it goes, of course, explodes in the media. People start talking about several people have died from this strain of flu. It's different.
This hasn't actually happened, but yeah.
Not here,
Yeah,
right? But
right.
elsewhere,
Right.
right? So the world starts getting concerned, and then departments of health across the country start getting kind of put onto alert. Is that correct?
That's pretty similar. For example, an example is not in Hawaii, but something MERS-CoV, the Middle Eastern Coronavirus Syndrome. It's something that when out of the Middle East, that's something that has come to the U.S.
Right.
And when it came to the U.S., all of the state, it came to Indiana, it came to Florida, and it did elicit, it was a novel virus, it elicited a lot of response from infection control folks, from CDC. Everybody, responded, and we were all aware of it. We all were communicating the states and the different health departments and CDC, so that we were all apprised, and we all knew what was going on, knew what to expect. And luckily, they contained it. It works just as planned.
What does that virus do to people?
That one actually causes a fairly severe respiratory illness. So they're still really feeling out exactly what animal it came from. Might be bats, maybe camels, who knows. But the key is that folks going to the Arabian Peninsula, the Middle East, have been seeing this respiratory illness with, I want to say the last numbers I saw were maybe a 30% mortality rate, predominantly in those with other illnesses, older, reasons to maybe have more severe illness. But that's a pretty significant mortality rate. And so it's of some concern to us at the Department of Health to make sure that if we were to see a case of that come here,
Right.
that we would be prepared. Now, we haven't, but.
Right. So it's interesting, the way you're describing it to me is you have a couple different things you worry about. Sometimes you worry about illnesses that are rare, but when they hit, they have a very high potential to hurt somebody, a high mortality rate. And then there's ones that are much more common, much broader. They're less likely to cause a high mortality rate, people dying. However, there's so many more people that can get affected. Like, for instance,
Influenza is actually a big one for that.
yeah, let's talk about that.
Yeah.
I think, because people love to watch on television and talk about the tragedy of these very significant viruses like Ebola, but the flu kills many, many more people,
Flu
right?
kills a lot in terms of absolute numbers of deaths.
Yes.
We are much more likely to be impacted negatively by influenza than we are by Ebola.
Okay.
And people kind of poo-poo, oh, I don't need my flu vaccine, it's not going to hurt me. We still see people, there still are mortalities related to flu. It tends to be in your older population and in your very young population, but at the same time, it's no joking matter. And it's getting a flu vaccine is a very easy way to try and mitigate the severity of the disease.
And you're talking about just the regular flu, right?
I'm just talking about the seasonal flu that everybody gets every year, that we harass everybody to get, that we say, make sure we even have school-based, and we still, this year again, we were able to put out the school-based influenza vaccination, Stop Flu at Schools.
Right.
We're able to launch that again this year. We're very happy to say that.
Yes.
And that actually is a very important thing, because what it does is children, sadly,
Yes.
tend to be vehicles for influenza. They they don't always do a lot of hand hygiene. They have a lot of disease that they spread sometimes. And so interrupting transmission or vaccinating in schools is a great way to try and prevent it from going out to grandma and grandpa at home, to other children, to people who can't be vaccinated. And so I think it's a really great program.
So you're saying kids can be vectors of infection because they don't
I was
wash
trying to
and they-
avoid that. I was trying to avoid that
and
very
they'll
term.
sneeze on each other, and okay, I get it.
Exactly, exactly.
It sounds like basically your goal, irrespective of the group, is to always do the most you can with the resources you have, right?
Right, it's exactly true.
If you can disrupt a large rate of infection so it doesn't reach some kind of threshold, then society doesn't get blasted by it. If it tips over, you reach a tipping point, all bets are off, and then we're just in the clinical phase of trying to manage symptoms.
We're just trying to do the best we can with what we have.
Right.
And that's a particular, for the vaccine preventable diseases, that is a big worry that we have as we're seeing more and more non-vaccinated folks.
When do we like to give vaccinations for our population in the state of Hawaii? What's the best time?
Depends on the vaccination. For flu,
Yes.
it's going to be this coming fall. I don't believe that we've gotten drop dates for the vaccine yet, but I anticipate hearing that before too much longer. And certainly the Stop Flu at School, the school-based vaccinations are going to be in November. I anticipate that the private practices might be able to provide it October-ish, maybe even late September.
Okay, I heard that, and I've heard tell over the years that flu comes to Hawaii a little bit later.
It does.
Is that right?
What I've learned in my short time here is flu here does what it wants to do.
Yes.
So one flu season does something and the next flu season might do something else. What we have seen is that what we've seen, at least in recent years, is that the peak in the mainland tends to precede ours by just a little bit.
Okay, so we have maybe a little warning, but that shouldn't dissuade people from getting their flu shots,
Absolutely
right?
not. We have so many visitors that from the mainland, and we have so many people going to the mainland and elsewhere that I really would get vaccinated when you can.
Yeah, I was on the plane yesterday with another pilot who was flying in, from the East Coast. So not only did we have all those travelers coming in, but also the pilots themselves, and then the stewards and stewardesses and what have you.
Exactly.
Yeah, I think it's fair to say that, at least I feel very strongly, people should get their flu shots. And again, it's not just because you and I, we're young, we can expect fairly confidently to fight off the serious effects of a flu, though it's no joy. However, if we're with a child, or we're taking care of people clinically, or if we're visiting people who've had kidney transplants or liver transplants, or who are just elderly, or have severe chronic lung disease or whatever, all of those individuals are going to be more likely to get the flu.
And the last thing you want to do is transmit it to them. Exactly.
Right. So part of our public duty as not just healthcare providers and health professionals is just as citizens. If we want to be a part of decreasing the burden of infectious disease, we should get our
The first
shots.
step is to get our vaccinations.
Right.
That's
And what else should
exactly
we do? We should wash our hands?
Make sure to wash your hands. Make sure, and this is something that I can't say enough, make sure you see your doctor on a regular basis and get your annual regular checkups. Make sure your children get their vaccinations.
Yes.
Make sure that simple things like make sure that you stay up to date on your vaccinations, and make sure that when you cook your food, you cook it properly. These are very simple things. They're easy everybody can do this every day.
Yes.
And yet doing these things will decrease disease in Hawaii.
Yeah, I appreciate you saying so, because prevention has been a theme often on our show, and I think that too few people realize that healthcare is not really just about getting open heart surgery or getting very advanced medications when you've got hepatitis or lung disease. It's about preventing people from getting to a place where they've got high blood pressure and then a heart attack, or preventing people from diabetes to renal failure and then dying from the flu because they don't have immunizations.
Exactly.
Okay. Well, we're going to take our third break here, and then we'll come back for kind of a wrap-up for 5 minutes where we can kind of pick your brain about what the most important things in your discipline are for the state of Hawaii.
Okay, thanks.
Great. So this is Josh Green, Healthcare in Hawaii. Thanks for joining us.
Hi, I'm Donna Blanchard, and I host the show Center Stage on the ThinkTech Hawaii digital series right here every Wednesday from 2 to 3 Hawaii time. I would really love to have you watch the show and see what we do here. I talk with some of the most amazing people, artists, most of them, all of them involved in some sort of artistic process. And our goal here on the show is to dig into that artistic process, and you would not believe what some people say, what some people do, what people go through to express. And these are people who have to express somehow, and I find that infinitely interesting. Not only that they have to express, but how they end up doing it. I really hope that you will watch the show and enjoy talking with some of these people the same way that I do. Thanks, and I hope to see you soon on Center Stage on the ThinkTech Hawaii digital series, Wednesdays from 2 to 3. See you soon.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, ER doc and senator. Today I'm joined by Melissa Viray, who's an epidemiologist and an expert in infectious disease control. She's been good enough to join us here in the state of Hawaii to work on these questions, and we only have a few more minutes, so I wanted to say, Dr. Viray, first, thank you for joining me today.
Thank you.
If you had just a minute or two to give advice to the people of Hawaii in your discipline, what would it be? What's the best thing to tell people about infectious disease?
I think if I had one message for people, in Hawaii in particular, I would say make sure that you stay up to date in your vaccinations. I think in terms of easy achievable goals, it's a very easy thing to do. It doesn't take much time, and it can prevent a whole smorgasbord of bad outcomes for you, your children, your family members, if just keeping your vaccinations up to date. Obviously, other things like hand washing and good seeing your doctor on a regular basis, those are all really important as well. But in terms of the one thing that people can do, easy thing to do, just to make sure they stay up to date.
Excellent. So again, we're so happy to have had you on our show. We often speak abstractly about healthcare challenges in our state, but today to have a concrete discussion about infectious disease has meant a lot. Today in the media we hear about all these very severe, catastrophic illnesses, but what Melissa has been able to tell us is it's very basic. Take basic precautions, get your immunizations, you will help save lives in your community, but do the basic things that are preventive to avoid getting infectious disease and in turn keeping us all healthy in the state of Hawaii. I'm so glad you were joining us
Thank you.
today. This is Healthcare in Hawaii. I'm your host, Josh Green. We'll see you again soon.